Excuse me, kindly give the BP monitoring sheet for this patient for last 4 days. I also need to get the temperature charting and share with me the pain scoring of this patient also. Oh, so what we are talking about? We are talking about the vital signs. So vital signs are the cardinal signs which are important to know the physiology of the body. So today we will be talking about the normal vital signs in this video. So normal vital signs are divided in various like temperature, pulse, respiration and BP. And recently we have added pain as a fifth vital and SpO2. So quickly we'll see about all of them one by one. So vital signs are also known as cardinal signs because these are the important signs which tells about the normal physiology of your body. So if we talk about temperature, so normal temperature is 98.6 degree Fahrenheit and in degree Celsius it is 37 degree Celsius when taken orally. If we talk about rectal temperature, it is 1 degree more than oral because of the high vascularization of that area. If we talk about the axillary temperature, it is 1 degree less than oral because of the increased amount of sweating and perspiration. If we talk about pulse, pulse is a contraction of left ventricular of heart. So every time whenever there is a left ventricle contracts, it will create pulse. And that pulse is normally it is 72 to 80 per minute. If we talk about respiration, it is a process of bringing oxygen inside the body tissues and removing all the carbon dioxide out of the body. And normal respiration is around 16 to 20 per minute. If we talk about blood pressure, it is 120 by 80 mmHg and blood pressure is a force exerted by blood against arterial wall. So blood pressure we have two values. One is known as systolic, another one is known as diastolic. So let's see what is systolic and what is diastolic means. Systolic means during the left ventricular contraction, the maximum pressure which is exerted on an artery is known as systolic blood pressure. That means whenever left ventricular contract, the maximum amount of pressure which is exerted on an artery, it is known as systolic pressure. And what is diastolic? When the ventricles are on a relaxation mode. During that time, whatever pressure is exerted on the artery, that is known as diastolic pressure. Then we have pain. Pain is a subjective symptom and that varies from person to person. So to assess pain, we can use different pain scales like numerical rating scale, visual analog scale. So to know more about the pain scales, you can refer to my another video which is mainly dedicated to pain only. So next we talk about SpO2. So SpO2 is a saturation of oxygen in the hemoglobin. So the normal SpO2 values is more than 95%. If it is less than 95% till 90, you can say 2%, we can just monitor our patient. But if it is less than 92%, I need to start O2 therapy as soon as possible. Then comes the factors which affects body temperature. So let's see one by one. So age is the first factor which affects body temperature. In younger age, the temperature tends to be more because of the high metabolism rate as compared to elderly patients. If we talk about emotional state, because of any sort of anxiety or anger, our temperature increases because of the release of cortisol and adrenaline hormone. Because of exercise, again body temperature increases because muscles are producing heat, because of which the body temperature increases. There is a diurnal variation also. That means different at the different time of day the body temperature varies. For example, when you get up from the bed, body temperature is very low, but it will go to its peak at afternoon. So it is diurnal variation. After the ingestion of hot and cold drinks also your body temperature affects, and smoking also increases the body temperature. Now quickly we'll see the pulse rate. So these are the factors which affects the pulse rate. Because of this emotional state, again if somebody is in anxiety, the pulse rate increases. Body temperature, if it is hypothermia or hyperthermia, in both the condition, if the body temperature is too low or too high, the pulse rate also get affected. Because of the dehydration also the pulse rate got affected. Whenever there is a dehydration, pulse rate increases because there is a decrease in circulatory blood volume. Because of insufficient nutrition, heart rate increases. Because of insufficient sleep, heart rate increases. Again because of age, your heart rate increases because the metabolism is more, they are more active, so their heart rate is more than the elderly patients. If we talk about the respiration, so I have divided in increasing and decreasing. So if we talk about the factors affecting respiration, so because of pain, respiration increases. Because of basal metabolic rate, respiration increases. Because of exercises, again, in order to get more oxygen, respiration increases. Because of smoking and pyrexia, respiration increases. If we talk about the decrease, if the patient is on sedative, respiration decreases, because this drugs directly works on your CNS system. So because of that, your respiration decreases, because your respiratory center is also situated in the brain. Because of increased ICP, again the respiration decreases. If we talk about the factors which affecting BP, so we have factors that is in increasing and decreasing. So according to the age, if the age increases, your BP also increases, and BP is also known as age disease of age. So that is the thing. If obesity is there, BP increases. There are more risk of getting blood pressure. During exercises also BP increases, but gradually it will decrease and subside also. Due to any of the illness, BP increases. If patient is having bleeding, burn, vomiting and diarrhea, blood pressure decreases. The reason why the BP decreases in all the four conditions is because there is a decrease in the fluid volume. So when the fluid volume decreases, there is a decrease in cardiac output. When the cardiac output decreases, obviously there is a decrease in blood pressure. So in case of any of the fluid volume deficit disease conditions like bleeding, burn, vomiting, diarrhea, always the BP decreases. So this is all about for this video. If you have any doubts, any queries related to normal vital signs, you can just put in comment box. Thank you so much.